In this chapter, we're going to explore community as our client. By looking at the whole community, it's possible to discover strengths within the community and to develop ways to bring these strengths to work for the community and the individual. To be effective and practice ethically, we must be aware of the broader context of human problems, no matter what setting we choose to work in. The foundation of all ethical practice is promoting the welfare of clients. To overlook the abilities, strengths, and resources within our communities is really doing a great disservice to the individuals we're working with. We need to help change conditions that affect people rather than simply changing people who are affected by these conditions. So in order to get started on our discussion with community and social justice, I want to introduce a couple of definitions out of your chapter. The first one is community agency. That's any institution, public or private, nonprofit or for-profit, designated to provide a wide range of social and psychological services to the community. A community worker is a diverse pool of human service workers whose primary duties include serving individuals within the community in a variety of community groups, such as social workers, mental health counselors, nurses, addiction counselors. The chapter suggests that advocacy for change is an ethical and moral obligation for an effective counselor. By addressing the cause of the problems within the community, we can help change the lives of many individuals, not just the one person sitting in our office or clinic. Community organizers first have to decide who the primary recipient of their intervention is. Is it an individual? Is it a group of people? Is it society in general? How do you begin to make a difference? First of all, list the communities where you belong. Do you have any influence in the various systems, like religious organizations, coaching, any other organization that you belong to? What social, cultural issues can be identified within these systems? Is it poverty? Is it crime? Is there some kind of discriminatory practice? The community orientation is based on the premise that the community itself is the most appropriate focus of attention, rather than the individual, and the community also is the most potent resource for solutions. So if you look at the community as a whole then, the clients, our clients, are group members, residents of target populations, and people who have been marginalized. Even when counseling clients, we should see how they might draw on community resources to help meet their goals. Communities have addressed coping mechanisms to deal with problems also. They've been dealing with these kinds of problems for a long time. What coping mechanisms do they use? Environmental factors cause or contribute to the problems of many groups in society. If you look at community counseling, that's a comprehensive helping framework that's grounded in multicultural competence and oriented toward social justice. So the focus of community work is on preventing rather than remediating problems. What types of clients and community interventions can we look at? So a community counseling model described by the chapter is based on two activities. The first one is facilitating human development by providing direct interventions with clients and community members. The second one is facilitating human development through advocacy interventions that break down external barriers to client well-being. So if I am a substance abuse counselor and I'm really upset because there's not enough funding to help indigent populations, what kind of an intervention might I employ to be able to try and make changes? Some ideas might be to go to community organizations and talk to them, try and get backing from different organizations, go to the legislature, write letters to the governor. I mean, there's a lot of different options to look at. And that's just one example of how we can be advocates in trying to implement interventions for change. Human development activities include both focus strategies, like outreach activities, advocating for clients like I just described, and broad-based strategies. These are more developmental and preventive program activities. In looking at direct client services, these are service providers focus on outreach activities to a population that might be at risk for developing mental health problems. So, for example, counselors provide help to clients facing crises or dealing with ongoing stressors that overwhelm them. These could include referrals from the court system, from churches. The goal is to empower clients with skills, knowledge, and understanding that will help them cope with these external stressors. Indirect client services, on the other hand, is client advocacy and consultation. They're at the heart of these services, and community workers create partnerships by working with groups in a collaborative way rather than merely providing services for these groups. So counselors will identify factors that negatively affect their clients and take action to bring about needed change. Direct community services is when community counselors serve their communities by offering preventive education programs geared to the population at large. An example of this might be things like life-changing workshops, interpersonal skill training, job training. The focus of preventive programs is on teaching effective living and problem-solving competencies. Indirect community services are communities workers strive to change the social environment to reduce the mental and physical health problems of the population as a whole by influencing public policy. I think a really good example of this one could be the smoking, how we went about educating the public on smoking, and then pretty soon they got laws passed, in the community as a whole, where you can't smoke. The focus is on promoting system change by working closely with those in the community who develop public policy, increasing public awareness, influencing legislation. The social justice perspective involves access and equity to ensure full participation in the life of a society, particularly for those who have been systemically excluded on the basis of race, ethnicity, gender, age, physical, mental disability, education, etc. The community work is not easy, and there's a lot of institutional obstacles. The main challenge for counselors is to take action and do what's necessary to meet their goals by drawing on the passion and commitment to make the world a better place. Counseling from a social justice perspective involves addressing the realities of oppression, privilege, and social inequities. Counselors with a community orientation are committed to making society a better place by challenging system inequities. Counselors who base their practice on aspirational ethics oppose all forms of discrimination and oppression. The goal of counseling is to promote the empowerment of people who are marginalized and oppressed in our society. Counselors can do this by accepting the idea that advocacy strategies and social justice perspectives belong at the center of a good practice. When we talk about advocacy competencies, that's when counselors function as advocates, when they use their skills to help clients challenge institutional barriers that impede their personal, social, academic, or career goals. Ethical practice requires counselors to assume an advocacy role that is focused on affecting public opinion, public policy, and legislation. Multicultural competence is essential in understanding the cultural relevance and appropriateness of advocacy interventions, as counselors bring their own attitudes and beliefs to the socio-political history of their communities. Social justice advocacy in rural communities have some unique issues. The chapter identifies 3 practical and ethical issues that mental health professionals often encounter when working in rural areas. The first one is many rural areas have few human service providers, so practitioners must often become generalists and work with a wide array of problems presented by diverse client populations. That makes it so that they really have to keep on top of continuing education and cultural competencies. The second one is learning to manage multiple relationships, which is absolutely essential. And lastly, practitioners must be diligent in protecting confidentiality. In rural communities, people often know each other, and you have to be really careful to make sure that you protect that confidentiality with each one of your clients. The roles of helpers working in the community really vary. Your chapter describes outreach interventions, as the outreach approach may include both developmental and educational efforts, such as skills training, stress management, parenting, consultation. Community counselors also attempt to change the dysfunctional system that is producing problems for individuals, families, and communities. School counselors are often cultural mediators. So cultural mediation is when the counselor facilitates communication and understanding between culturally diverse human systems that aid the educational progress of all students. Function includes things like communicating with the families and community resources and social service agencies, serving as an information hub for culturally diverse families, things like that. School counselors can be very influential.